Good, happy Thursday evening. I'm Riley King, and welcome to this Thursday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday evening, so let's begin. First up, let's begin with a look at your COVID-19 numbers here in New Hampshire. And here is a look at those COVID-19 numbers here in New Hampshire for all of you right now. There are 7,764 number of people in New Hampshire have tested positive for COVID-19. There are 1,191 number of deaths from COVID-19 in New Hampshire, and there are 78 current number of hospitalizations for COVID-19 in New Hampshire. And that is a look at your COVID-19 numbers here in New Hampshire. New Hampshire set to launch new vaccination sign-up system. VINI system intended to be easier to use and more robust. Let's take a listen to that video right now from Governor Chris Sununu's COVID-19 briefing that he did today. Let's learn more about this new system right now.
With the Planet Fitness Black Card and get all the perks like massage chairs and so much more. Join today.
Get all the perks of the PF Black Card for no enrollment with no commitment. Hurry, this offer ends March 16th.
And that success allows us to easily slide into our next vaccine undertaking, as Dr. Daly discussed, phase 2A, and we can move there in very rapid time. So thanks to good management, we've been able to move folks in 1B up. 2A will be starting this coming week, which is very exciting. And as to repeat some of the numbers that Dr. Daly said, nearly 40 school districts are going to begin the process of vaccinating teachers. About 17,000 right now are already in queue to have their own pods and to be vaccinated. And starting tomorrow, Manchester, Salem, and Dover, schools will have their own first closed pods beginning through that process. So it's very good news. The state's new vaccine appointment system that we've been kind of hoping would rise to the occasion, that is going to go live on Wednesday, March 17th. School, childcare, and youth recreation staff as part of Phase 2A that might not currently be scheduled to receive their vaccine through one of the regional public health networks will be able to sign up for an appointment next Wednesday with first shots to begin very soon thereafter on Monday, March 22nd. Those 50 and up will be able to schedule their first shots starting on the appointments on March 22nd, with the first shots beginning on March 25th, as you can see here next to me. And we do know that a lot of individuals had problems with initially with the federally run VAMS system. You've heard us talk about VAMS a lot. And today we're here to walk you through the steps on how to go about scheduling your vaccine on our Vaccine and Immunization Network interface, or as we are affectionately calling it, VINI for short. Vinny can always get the job done, right? So let me walk you through it. The process is very simple and streamlined. We have a couple screenshots here for you. Early next week, before the site goes live, we're going to launch some instructional videos if folks want to walk them through the steps so they kind of have confidence in registering with the system and scheduling for an appointment. I've actually already gone through it myself just to test it, and it is just a world of difference better and simpler than the older system. So there's really, I guess you could call it 5 steps in total. Step 1 is simply going in. We call it the screening and pre-registration. There's some basic questions, all the same questions that folks would have seen during the original VAMS pre-registration process, just to make sure that folks are eligible. Are you 50 years old? Do you have underlying conditions? Are you a school teacher? And you'll be able to choose what district or school that you actually work for, which is great. Step 2 is very simple. You schedule your appointment. You can simply pick a date, and so we try to make it very easy. You can pick what day you want. You can pick all the times that might be available in your area for any number of, you can search for sites within a certain radius of your home. Just a whole lot simpler and user-friendly. And then you show up for your appointment and you receive either the Moderna, Pfizer, or possibly even the Janssen vaccine. And then if folks want to go in, they'll be, again, we've always made that promise that we will pre-schedule their next shot for them, or they can go into the site and change the date if they so chose to do that for their second shot. Go back to your second shot and when the time comes and off you go. So it's a very simple process. We really tried to streamline it. It takes a whole of 10 or so minutes really to kind of do that pre-registration, wait for an email back, go in and pick your time. We've tried to really make it simple. So we're not going to bore everyone today with all the little details there, but again, we just wanted to give people a feel for the site as it comes up and running. We'll again have fact sheets, videos, different documents to walk people step by step through the process and answer questions. The other the big difference in this process is in the previous process, you had to, if you wanted to change your appointment, you had to go in and cancel your original appointment, which could be a kind of an anxiety-filled, risky thing. In this new system, you can pick a new appointment before anything automatically gets canceled for you. So there's no risk in constantly trying to move yourself up. And that's really what the system is designed to do, put a lot of the reliance on the individual. As we get more vaccine, you'll always be able to go in, very easily move yourself up with no risk of losing your original appointment. I think, which again is going to be a big sigh of relief for everyone who was taking the calls on 211 and everyone who kind of got jammed up in the system over that very tough week as we worked out some of those kinks. And again, the other big piece of this finally is that Vinny was built and it will be managed right here in New Hampshire. We are not relying on the federal government as part of this system. We're not relying on the CDC, and therefore we, in very real time, can make any adjustments or amendments to the system. We can add additional times as vaccine becomes available. We can add new sites. It's just much more flexible to the operations that we want to see and that will best suit the needs of the citizens of New Hampshire. And so in all, we're obviously very pleased to officially introduce Vinny next week, and we think it'll just ease a lot of anxiety around that process.
Okay, and there you go on that video. A new system to schedule your appointment. New Hampshire's mask mandate to remain in effect as more business sectors reopen, Sununu says. Mask order first took effect on November 20th, 2020. Let's take a listen to this video.
Over the past year, our local New Hampshire businesses have shown amazing resiliency. They've gone the...
But one last thing revolves around our guidance documents. Obviously, as our numbers trend down, both in hospitalizations and fatalities, as vaccinations trend up, all very positive steps. So we want to provide additional flexibilities based on the data that we're seeing here. There's no doubt that the numbers continue in the right direction. It is important to note that we are still keeping the mask mandate at this time. It has proven to be effective. Masks work. Social distancing works. I keep repeating the very clear data point that virtually no one in the state has the traditional flu. We really are doing the right things, and a lot of the other indirect benefits are being brought to bear. So that's a good sign. But what we can do is safely flex open some of the opportunities in industries around the state. So we've looked at the COVID data both regionally and nationally. COVID cases continue to decline across the country while vaccinations go up. And so following similar announcements made very recently from other Northeast states like Connecticut and Maryland, effective immediately, we'll be transitioning our out-of-state travel restrictions from a requirement to a recommended advisory. And again, this follows along with our essential travel guidance. So we're really marrying together the more recreational, non-essential travel with essential travel. Now they all kind of live under one streamlined approach. We still recommend folks to quarantine. We recommend folks to be tested if they are on extended trips, but it is no longer a requirement going forward. Likewise, residents from outside of New England no longer have to quarantine prior to arrival to New Hampshire. So this change applies only to domestic travel, not to international travel. So we're only looking at domestic travel because that's where we feel very confident about the data. The trends are very positive all across the country, which gives us some flexibility going forward. So why are we doing this? First, for a few reasons. First, our most vulnerable citizens are getting vaccinated. The vaccination process is moving very, very well, not just here, but across the country. This does bring us in line with other states across the country. Third, we are keeping our mask mandate. We're still keeping a lot of the, I think, important pieces in place to make sure that we have a handle on the spread of COVID. And fourth, we want to help businesses plan for the summer. We know it's going to be a very good summer. We know a lot of folks across the country and the region are planning now for what their travel plans might be. And so we don't want the tourism industry to suffer. They took the brunt of the hit, if you will, last year. And we just want to make sure that we're kind of preparing. We're staying ahead of the game a little bit in terms of the opportunity this coming summer. And so we just see this as a common sense move. So today we're also flexing open a few other areas, as you can see next to me, not just travel, but also effective immediately. Capacity at retail stores may increase and return to 100% capacity. Barbershops and salons may choose to allow walk-in customers without reservation and resume the in-person waiting rooms, obviously with some restrictions there, and the guidance has been updated to reflect that. Restaurants and bars can resume things like karaoke, pool, darts, and other bar games at their establishments, as well as small bands of 3 or less members, again, as long as they maintain that 10-foot buffer from the audience. But allowing a little more entertainment within those venues we see as a smart and safe move. At hotels and lodging establishments, we're making a few minor changes, and they can see those to things like the lobby area and whatnot, and you can see some of those on our website. And then finally, I'm going fast, so I appreciate David keeping up. We're modifying our guidance surrounding our overnight and day camps to add flexibility for our operators. They came in and I think there was a great discussion and a lot of really good ideas put forth with our Reopen Committee. And all of these have been authorized and approved through the Reopen Committee. So I just encourage folks to go to the website to see the details of those guidance documents. But it's just another logical first step. Things are going in a good direction. We're not just going to rip the Band-Aid off and open everything up wide open. That would not be a very smart thing to do. We're just not there yet. I think we all hope we will be at some point. My goal has always been to try to get there before Memorial Day, and I think we're on target for that. But we really just need to take these common sense steps to help these industries. We can do it in a safe way. We know so much more today than we did just even back last summer when we were creating a lot of these flexibilities and guidance documents for our businesses. So we just use that data and that knowledge to create opportunity for our citizens.
Okay, and there you go on that video and that report. Police release more information about Manchester woman's death and seeks tip. Cynthia Halloran, 69, found dead on December 30th. Let's take a listen to that video from WMUR News 9.
The skills I'm learning during the Syracuse University online MBA program are, from day one, immediately applied to my work responsibilities.
And we now know the name of the person found in Manchester yesterday. The Attorney General's office says the body of 69-year-old Cynthia Halloran of Manchester was found behind one of the fields in the Youngsville baseball complex. The medical examiner's office says the cause and manner of her death needs further investigation. Manchester police is now tracing Halloran's whereabouts between 5:30 and 7:30 yesterday morning.
Okay, and there you go on that video and that report. Few signs of improvement in New Hampshire's latest drought map. Monitoring wells still running low, environmental officials say. Let's take a listen to that video from WMUR News 9, Ray Brewer.
Get moving with the Planet Fitness Black Card and get all the perks, like massage chairs and so much more. Join today.
Get all the perks of the PF Black Card for no enrollment with no commitment. Hurry, this offer ends March 16th.
We are very concerned.
The latest drought map shows the Connecticut River Valley with the highest level of drought in the state at a moderate drought, and the area surrounding it abnormally dry.
But the impacts from the 2020 drought in the southeastern New Hampshire have me the most concerned.
This is typically the time of year when observers look for signs of recovery from snowpack, surface water, or other measures, but those signs are not there.
In each of those areas, we're seeing indicators that are very similar to where we were this time last year, or perhaps even slightly worse.
That can be seen in a map for monitoring well in Franklin. The line in blue represents the monthly median. The red line, what is currently happening. O'Donovan says that reflects what they're seeing elsewhere around the state.
They are low and almost outside the bounds of what we consider to be normal, and also not recovering.
There is some good news in that the long-range forecasts are predicting some improvement. Still, DES says homeowners should be practicing water conservation.
Some other advice for homeowners. DES says if you have a shallow dug well, well, now would be a good time to get in touch with well drilling companies. Odds are you're going to need it. Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. Woman dead, man seriously hurt after a fire in Seabrook, New Hampshire. Woman dead of smoke inhalation, officials say. Let's take a listen to that video from WMUR News 9.
Get moving with the Planet Fitness Black Card and get all the perks like massage chairs and so much more. Join today.
Get all the perks of the PF Black Card for no enrollment with no commitment. Hurry, this offer ends March 16th.
Breaking news this noon, an investigation into a deadly fire in Seabrook. The state fire marshal says it broke out on Spruce Court at 10:30 last night. A woman died of smoke inhalation and a man was seriously injured and flown to a hospital in Boston. Their identities are not being released. The cause of the fire is under investigation. This is the fifth fire death in New Hampshire this year.
Okay, and there you go on that video and that report. And happening tonight, President Biden makes his first primetime address to the nation to commemorate the one-year anniversary of the COVID-19 shutdown. We will be sure to give you that coverage starting tonight at 8 p.m. ABC News Live and the ABC networks will bring you that coverage in NBC News and CBS News networks as well. President Joe Biden addresses the nation tonight, starting at 8 p.m. And that does it for this evening edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your evening, and I'll see you back here tomorrow for another newscast. I'll have news coming up in a little bit. Good night and goodbye, everyone.